that when you're going to use the wheelchair, that the wheelchair is a piece of equipment, and the equipment is functional, right? So if you have a damaged piece of equipment, you can't use it. Just like if you have an extension cord and the extension cord got a crack, a split, or burnt in it, you shouldn't use it, because if you plug it up, you have risk of what? Fire or electrocution. Same thing with the wheelchair. If the wheelchair is malfunctioning in any shape, form, or fashion, you cannot use it, because what? You have risk of the patient falling or hurting themselves. So you will not use the wheelchair. So you have to check the back piece. Make sure the back piece is not cracked, as long as the seat is not cracked as well. So you have to check the seat. Make sure that all the screws are flushed, and that will not hurt or interfere with the patient's skin. You know, like scrape their skin or anything like that. You have to learn how to open and close the wheelchair. There's specific ways they want you to do that. So to close the wheelchair, you will grab the seat in the middle and you will pull directly up. This will close the wheelchair. 1, 2, 3. To open the wheelchair, same thing. You will take your hands, push on the seat. Okay? Push down on the seat and the wheelchair will open. Do not try to open the wheelchair through the armrest or through the pulling mechanism. Do not do that. You will make the wheelchair be twisted, unequalized. The wheelchair will be twisted to one side because you're forcing. One hand is stronger than the other. You're forcing against the grain. You lift the clothes, and on the seat you push down, and the chair opens immediately. Also, you need to know where the brakes are located. The brakes are located right above the large wheels. There's 2 of them, one on each side. You also have to know about the footrest. 2 sections. Front part, black part, you can put them down. Foot goes here. The back of the heel leans on this so the foot doesn't slide off. Alright? Also, the footrest can be moved 2 pieces. 1, 2, or it can be removed totally. Okay? Line up the holes with the little pegs. Put it back in. Close. Both sides do the same thing. Okay? Front wheels do not have, the small wheels are called casters, they do not have brakes. But they will not move when this one is in place. They will not move. Okay? Also, there's a seat belt. You will not use the seat belt unless there is a doctor's order. The seat belt is considered a restraint. Okay? So you cannot place the seat belt on the client unless you have doctor's orders or is noted on the care plan. If necessary, patient is in danger. You have some patients that they start sliding down the chair. You have to be picking them up every 2 minutes. So if it's noted on their care plan, then you can execute, meaning you can use. Right? Alright, so the skill for this morning will be transfer. You're going to transfer the patient out of the bed and into the chair because he's going to go wherever. Or you just need him to get out of the bed. He's been in the bed too long. Also change of position. You don't want him to get bed sores on the back of him because he's been laying in the bed for 12 hours straight. Right? So, for this skill you need your wheelchair. You need a blanket or a lap robe. L-A-P-R-O-B-E. Lap robe. You also need a chuck. And you need the transfer belt. Okay? This is also called the cape. So you need these elements. So you're going to start off the skill as you always do. You're going to knock on the door. You're going to introduce yourself, name and title, and you're going to address the patient by name. Good morning, Mr. Jones. My name is Lisa Santiago. I'm your certified nursing assistant for today. I'm here to transfer you. I'm going to get you out of the bed. I'm going to place you in the wheelchair. I'm going to take you to the day room. Is that okay with you? He tells you yes. That gives you the green light to go ahead. You're gonna go to the sink and you're gonna do hand washing technique. After you do your hand washing technique, you're gonna come back to the client and ask the client if you could check the ID to ensure that he or she is the correct client that you're rendering the skill to. So he is who he is. We're gonna provide the privacy and we're gonna gather the equipment. When you gather the equipment, you're gonna bring the chair to the side of the bed, and you're gonna go through the items that I went through when I showed you. You're gonna open and close the chair. You're gonna check the back. You're gonna check the seat. You're gonna check the brakes. You're gonna check the foot wheels. You're gonna make sure that all 4 wheels are intact and everything is in working order. You do that so the proctor can know that you know what you're doing and that the chair is intact and it's not faulty equipment. And your patient will go into the chair in a safe and proper manner. So that's why you check the chair in front of the proctor. Now that you have done that, you're going to take the chair, you're going to bring the chair, and you're going to line it up with the back of the bed. Right? So this and this is supposed to be even. Then you're going to bring the chair, and you're going to put a 45-degree angle to it so you can receive the client. You're going to move these things out of the way because they will be in your way. Okay? So you have a clear path to receive your client. You're going to lock the wheels and lock the chair in place so it does not move or shift in any shape, form, or fashion. These items you're going to move out of the way. You're going to place them here on the bed because you're going to need them. Right? So now you have your client. Your client is going to be semi-dressed and is going to be laying on top of the sheet. They're not going to be covered. They're going to be ready to receive you. The client also is going to be laying flat. The bed is going to be flat. And this skill is the only skill where you do not raise the level of the bed. The bed stays closest to the ground. Why? Because when you sit him, his feet must touch flush with the floor. Can't be high up the bed. Okay? I will really need a volunteer for this, but everybody needs to see it, so I'll try to do it as best as I can with the mannequin. It's going to be a little difficult. All right? So the first thing you're going to do is you're going to bring the chuck. You're going to open the chuck. You're going to place the chuck underneath them because you're going to put on their shoes. You're really going to do this on skateboard. So you're going to bring the person's shoes. You're going to place the shoes on them so they can be ready to receive the floor. Right? Can't put them on bare floor. Can't put them with the socks on the bare floor. Is dangerous because what can happen is slip and fall. So, all right. So you're going to instruct the client on what you're going to do and how much they're going to help you. It's only a limited amount of help that they can do with you. They're going to help you as much as they can to sit up in the bed. So you're going to ask the client to cross their arms, right? So their arms are crossed. You're going to take your hand and you're going to run it across their shoulder. So you have improper body mechanics because you're bending from your back. So you're going to take this hand and you're going to prop yourself on the bed. And you're going to instruct the client on the count of 3. Can you please help me as much as you can? And we're going to sit up. 1, 2, 3. So the client sits up. Once the client sits up in the bed, you ask them, do they feel dizzy or lightheaded? Because you're coming up. When you come up and you come up too fast and you've been laying for a long time, you get dizzy. Right? So now the client is sitting. They're comfortable. No dizzy, no nothing. We're ready to go to the next step. The next step is to swing their legs around and make them sit at the edge of the bed. So that's what we're going to do. I'm going to take my hand. I'm going to place it underneath their knees. And on the count of 3, I'm going to swing them around. Okay, Mr. Jones? On the count of 3, I'm going to bring your legs around to make you sit at the edge of the bed. I want you to help me as much as you can. Ready? 1, 2, 3. So now they're sitting at the edge of the bed. Right? Remember, he's a dummy, so he can't say that. So now, next thing is the gait belt. The gait belt is needed. You're going to put it around his waist. It's similar to ambulation. The belt is going to help you to stand them up and get them into the chair. So we're going to put the gait belt around him. Okay, Mr. Jones, I need to put this around you. This is going to help me to lift you up and put you in the chair. Okay? Is that all right with you? So it gives me the okay. So now we're putting the belt on.
What's happened if they say they feel dizzy?
They feel dizzy, you lay them back down.
Okay.
And then you retry?
Yes. Wait
For-
5 minutes and retry.
Okay.
When you sit them up,
Mm-hmm.
that they're sitting up right here like this, and they feel dizzy, you tell them to hang their head down a little, like going towards their knees, and then you wait like a minute, then you ask them to sit up straight, and if they feel better, then you turn them. If they're dizzy here, then you wait for 5 minutes and let them recoup and get back together. You can put the belt on, talk to them. They feel better, we're ready to proceed to the next step. The next step is make sure the chair is close to you as possible, right? You're going to ask the client to separate their feet. You're going to stand in between their knees, right? So you're grabbing their knee. My knee, my two knees is grabbing his knee.
Mm-hmm.
See, like this. That's called a knee lock. Right? You're gonna take both of your hands and you're gonna go hold the gait belt underneath. Now technically, he's supposed to hold me here, but he's a dummy.
Right.
He can't hold me.
Okay.
But both of
Hold
these
your
hands,
arms.
both of these hands are holding my arms.
Okay.
That gives him leverage, support, and makes him feel safe that he's not going to fall. Right? So he's holding me there. I hold underneath the gait belt, both of my hands, and I got him. Alright? On the count of 3, we're gonna stand. When I stand you up, I'm gonna turn towards the chair. You're gonna take your hand and you're gonna grab the armrest and I'm gonna sit you down. That's what you explain to the client to do, but he can't
Right.
reach.
So you explain that, right?
Right, so I explained it to him. So on the count of 3, we're going to lift them up. We're going to turn them towards the chair. That is called pivoting. Pivot. Okay? Ready? 1, 2, 3. I lift, turn, and sit. Right? So once you lift, you turn, and you sit. The person takes their hand and grabs the chair. When you turn them, they grab the chair so the arm is not in your way. Alright? So now they're sitting comfortably. You have to remove the gait belt. Do not leave the gait belt on. Are you okay, Mr. Jones? Comfortable? Almost done. Let me just remove the gait belt. I'm going to open up the brakes and I'm going to bring the chair, swing the chair around a little so I can have some room. You're supposed to squat down, bring this around, lift the patient's leg and put the patient's leg on the footrest. Okay? Lift the patient's leg, bring this around, put the foot on the footrest. You okay, Mr. Jones? Cover you up. It's a little chilly out here. We're going to go to the table. We're going to cover all his legs. Don't leave nothing exposed. Okay? The bed you don't really have to do anything to. Gait belt. This goes in the garbage because it had his dirty footwear. Alright, I'm gonna open this up. Okay, here we go, Mr. Jones. Make sure he has his core mount. Open the curtain. Wash your hands. Tell the proctor that the skirt is complete.
Okay.